Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites fewmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the disorders due to poisons in children. The children between the ages of 1 and 4 years of age are liable to be victims to poisons if they are kept in excess of the children. The other reasons are changing the container of the rat poison, etc. In Western countries, it is the drugs which are taken by the children. In India, it is kerosene, pesticides, etc. Poisonous plants are present in the yard. Seed poisoning is possible. Example: opium poisoning. Kerosene poisoning, common in 1 to 4 years and not more than 2 ml is ingested by the child. More than 10 ml if ingested is dangerous. Clinical features: mother finds the child near the container coughing with a kerosene smell from the mouth and flushed face. There may be vomiting, could be pneumonitis. On auscultation, crepitations and bronchi may be heard. Inhalation may produce lipid pneumonia causing pneumothorax, emphysema or pulmonary edema may occur as a result of secondary infection. Older children may complain of headache, giddiness, epigastric discomfort and dryness of mouth. Fever may be present up to 104 and first day. If more than 10 ml is ingested, cause neurological complications like fits and coma occur rarely. Treatment: preventive antibiotics, penicillin with streptomycin or tetracycline to prevent the secondary infection of the lung. Oxygen may be required for rapid breathing of pneumonitis. In severe cases, the more kerosene ingestion, gastric lavage is done with a normal saline or 3% sodium bicarbonate solution, and after that sodium sulfate should be left in the stomach. Steroids: prednisolone 2 mg per kg is helpful to reduce the pulmonary inflammation. Food poisoning: gastrointestinal symptoms like vomiting, diarrhea occurring within 24 hours of ingestion of the food contained with bacteria, chemicals or toxins. These are of 3 categories. Bacteria may be Salmonella, Shigella and paratyphoid types. Toxins: Staphylococci, Pseudomonas, Klebsiella welchii and Streptococcus. Third variety and certain chemicals are causing the poison. Clinical features: in case of toxins, the incubation period is from 2 to 6 hours. Starts with salivation, nausea, vomiting, abdominal pain, loose motion, hypothermia and collapse. In case of infections, incubation period is 12 to 48 hours. Gastrointestinal symptoms: vertigo, respiratory failure, dry tongue. In case of chemical poisoning, symptoms appear within a short time. In addition to gastrointestinal symptoms, there may be metallic taste and soreness of mouth. Diagnosis: if a group or a number of family members are affected after taking the same food, culture of the stools is helpful. Treatment: not for all self-treatment, as there are other factors to decide the treatment. First thing is supportive therapy with parenteral fluids Antibiotics like chloramphenicol 50 milligrams per kg per day, ampicillin 50 milligrams per kg per day. Increase of botulinum poisoning, gastric lavage, specific antitoxin up to 50 ml is given after test dose. Turpentine poisoning. Lethal dose is 15 ml and diagnosis is made by the smell. Symptoms are burning mouth, stomach, nausea, vomiting, diarrhea, headache, giddiness, tinnitus, shock and coma. Treatment. Antibiotics, steroids and if no pulmonary or nasal complications, forced diuresis may be of help. Lead poisoning. It is rare and by licking the toys and other paints. In acute poisoning, symptoms are nausea, vomiting, abdominal pain, muscle weakness, ataxia, convulsions, etc. Chronic poisoning is called plumbism, characterized by weakness, leadliness on the gums, muscular weakness, etc. Diagnosis. Leadliness on the gums, increased density of metaphysis and radio-opaque densities in GI tract, fecal excretion of more than 125 milligrams of lead. Treatment. Supportive anticonvulsants, mannitol, steroids, BAL 4 milligrams per kg. రండి అమ్మా ఒక 5 minutes పడుతుంది, ఒక 5 నిమిషాలు పడుతుంది కూర్చో. Every 4 hours. And EDTA 50 milligrams per kg IM or IV. Penicillinamine 50 milligrams per kg per day and calcium gluconate 10 milligrams per solution IV is helpful, not for self treatment. Corrosive acids, burning in the mouth, throat, esophagus and substernal region. Treatment. Demulcents like milk, egg white, large amounts of water and supportive therapy to combat shock. Tracheostomy and endotracheal tube may be required. Steroids and gastric perforation may need surgical treatment. Naphthalene poisoning. Naphthalene balls are absorbed through skin and lungs also, so keeping the balls in clothes and children is contraindicated. Nausea, vomiting, fever, coma and convulsion. If baby suffers with glucose 6-phosphate dehydrogenase deficiency, hemolysis may be severe. Managed by gastric lavage and demulcent drinks, forced diuresis and blood transfusion. Insecticides. Agricultural pesticides, salivation, sweating, tears, bronchial secretions, nausea, vomiting, diarrhea, headache, blurring of vision, etc. Treatment. Atropine with choline esterase inhibitor PAM specific antidote for organophosphorus poison. Datura poisoning. The seeds are mistakenly taken and the symptoms are of atropinism, dry mouth, decreased sweating, dizziness, dilated pupils, delirium, hyperpyrexia, tachycardia and hypotension. Treatment. Induction of vomiting, gastric lavage with strong tea, 3% tannic acid or 30 drops of tincture of iodine in 540 ml of water. Oxygen, paracentral fluids and catheterization may be necessary. Castor seeds. Nausea, vomiting, bloody diarrhea, collapse, oliguria, convulsions and coma. Treatment is induction of vomiting, fluid therapy and forced diuresis. Gelatropis glandulosa. Vomiting and diarrhea. Symptomatic treatment is needed. phenothiazines. The drugs used for control of vomiting and poisoning may be accidental. Symptoms may be extrapyramidal respiratory depression and fall of blood pressure. Treatment: diphenhydramine 2 milligrams per kg IV or promethazine 0.5 milligrams per kg IM. Gastric lavage and paracentral fluids. Scorpion sting. The child is having a profuse sweating, cold skin, restlessness, hypotension and vomiting, generalized convulsions, hyperpyrexia and congestive heart failure. Treatment: if no tachycardia, adrenaline healthy and at 50 minutes intervals, specific antivenom calcium gluconate 10%, 5 to 10 ml IV. If pulse rate is rapid, 160 per minute to 200 of fluids, 200 cc of fluids. Lytic cocktail: pethidine 100 milligrams, chlorpromazine 50 milligrams, promethazine 50 milligrams, made up to 50 ml with 5% glucose in distilled water, is prepared and given by IV in a dose of 0.3 cc kg every 20 minutes. Digitalis and steroids IV or sodium bicarbonate and molar lactate are also good. General measures for pain: lignocaine, emetic or cold compress of sodium bicarbonate, oxygen suction and IV fluids were indicated. Bees and ants and wasps: circulatory collapse and laryngeal edema, itching, local pain. Treatment: local application of sodium bicarbonate or tincture of iodine, amphetamines and adrenaline 1 in 1000 solution SC relieve the itching. In severe cases, steroids and supportive measures are indicated. Snake bites: the main varieties of snakes are Elapidae, cobras, cratis. Venom is neurotoxic and cause glossopharyngeal paralysis and respiratory failure. Crates contains hemolysins and neurotoxins. Viperidae: Russell viper, pit viper, etc. Cytolysine, hemorrhacin. Hydrae: poisonous water snakes. Signs and symptoms: general fright and shock, local burning pain, later numbness in cobra bite. Frank mocks: cobra bite sharp, so may not find. Viper bites are visible, usually specific symptoms. Cobra symptoms are quick burning pain at the site, headache, dizziness, myalgia, dysphagia and respiratory failure. Viper slower, severe and increasing local pain, swelling and discoloration, serosanguinous discharge from the puncture. Necrosis and even gangrene may supervene. Hemorrhages from the gums, nose, hemolysis, hematuria may occur. And lastly, cardiac failure. Treatment: to prevent absorption of toxin, the limb is placed in a dependent position and packed with ice. A tight ligation is applied proximal to the bite and may not be too tight. The ligation is loosened 1 minute every 15 minutes. After treating with the antivenom, some recommend a linear incision at the site of incision, but if it is a viper, may lead to hemorrhage. Counteraction of toxin: antivenom is the remedy of choice. 20 to 30 ml of polyvalent serum or specific serum, if snake is being identified, is given IV after test dose. EDTA at the site of bite is helpful to stop the bleeding and necrosis. The danger of anaphylactic shock of serum is countered by adrenaline and infusion of toxin with dextran slowly. It may be repeated after an hour. Children may require large doses as the concentration of venom per kg body weight. Infiltration of the site with 2 ml of 0.5 carbolic acid soap solution has been reported. General measures: reassurance and sedation with phenobarbital. Adrenaline and Foramin are given. Oxygen artificial respiration may have to be used. Antibiotics ampicillin 200 milligrams per kg per day is preferred, as bites are associated with gram-negative organisms. Tetanus toxoid, if not immunized, tetanus immunoglobulin 250 milligram units should be given. Hydrocortisone 1 gram IV every 4 to 6 hours. Blood transfusion, if necessary, is beneficial. That's all about the disorders due to poisons in children, and in the next video I will discuss about some other disease. Thank you.